This presentation is about defeating diphtheria with immunizations. It is by Esmeralda Chavez, Janica Kutsier, Brianna Michelharji, and Melissa Tafoya.
What is diphtheria? Diphtheria is a bacteria that attacks your throat and nose, which is your mucous membrane. How does it affect the body? Diphtheria produces a toxin that attacks your body. It causes children and adults to get very sick and even die without treatment. Let's take a moment and let's thank the Nobel Prize winner, Emil von Behring, for developing the vaccine. It says diphtheria is deadly. Immunization is the safeguard. Well, according to the CDC, 100,000 to 200,000 cases were reported, and 13,000 to 15,000 deaths were reported in the 1920s, mostly children. This was before the vaccine. Cases began to decrease in the 1940s once the vaccine was given. Now we know the importance of getting vaccinated against diphtheria. Knowing how often to receive the vaccine, the risk and the benefits will help control a future outbreak.
Immunization. Diphtheria vaccination is recommended for people of all ages according to the CDC. The vaccine contains inactivated toxins referred to as toxoids. The vaccine produces an active immune response of the body. Now let's review some of the risks associated with the vaccine. Soreness at the injection site, fever, headache, tiredness, loss of appetite, vomiting. Seizures is a serious but rare side effect of immunizations. Now let's review some health benefits. Preventative medicine maintains an open airway, decreases organ damage, a reduced mortality rate, and improved quality of life.
Diphtheria in relation to healthcare. Currently, diphtheria outbreak is rare due to healthcare resources and vaccination. Most cases reported have been imported from other countries. Unfortunately, diphtheria is still widely active in other countries due to limited healthcare and vaccination options, which leads into the importance of maintaining diphtheria vaccination. Diphtheria is contagious to all ages, and vaccination should be administered to all ages. To prevent outbreak of disease, vaccination should be maintained every 10 years. In addition, by maintaining vaccination and being cautious of exposure precautions, it can lower risk and maintain rarity of infection. If exposed and untreated, it can lead to serious health issues and can become fatal.
For our presentation, we've came up with 3 main points of the overall importance of being vaccinated against diphtheria. The first one being prevention. Any disease that we can prevent from coming back into our community, we want to make sure we do our part to do that. We also want to protect ourselves and others. So it's very important that our schools are safe, our kids are safe, our healthcare system is safe, and all of its workers. And of course, the benefits of the public health of vaccination to not have this disease or any other disease come back into our communities is always important. Side effects are normal and expected with the diphtheria vaccine. There will be some injection site soreness. You may have a slight fever or headache, and you may feel that you are more tired than you usually are. Adverse effects, however, are those that you should seek a medical attention for. Any chest pain, any loss of consciousness, any tingling or numbness in your extremities is alarming, and that is when you should go seek help. It's very important that you are aware of these things. It's very important that you understand the mechanism of action of these vaccines. But also, it's very important that you understand the signs and symptoms to look out for when this disease is prominent. Early detection and rapid treatment is what they have seen to provide the most success. After initial diphtheria immunization, how often do you need a diphtheria vaccine? Some possible answers are every year, only while pregnant, every 10 years, or only at birth. If you answered every 10 years, you are correct. The rationale for this is tetanus and diphtheria is only required every 10 years for immunity. They conducted a survey between 1988 and 1994, and it was only detected in 91% of individuals, so they recommend 10 years now.